Heart murmurs. Symptoms, causes, diagnosis, and treatment in Waco TX. Heart murmurs can be innocent or abnormal. A harmless heart murmur doesn't signify heart disease and doesn't need treatment, but harmful heart murmurs require treatment. Heart murmurs can be present in a child at birth or occur later in life. Symptoms of heart murmur. A harmful heart murmur may cause the following symptoms. First, swelling or a sudden weight gain. Second, shortness of breath. Third, chronic cough. Fourth, enlarged liver. Fifth, enlarged neck pains. Causes of heart murmur. First, innocent heart murmurs. Second, physical activity or exercise. Third, pregnancy. Fourth, excessive thyroid hormone in your body. Fifth, lack of sufficient amount of healthy red blood cells. Risk factors of heart murmur. First, family history or a relation with a heart defect associated with heart murmurs. Second, a weakened heart muscle. Third, an infection of the lining of a heart. Fourth, blood disorders due to a high number of certain white cells called eosinophils. Fifth, certain autoimmune disorders including rheumatoid arthritis. Sixth, heart valve disease. Treatment of heart murmurs in Waco TX. Harmless heart murmurs don't require treatment. Treating the underlying condition that may be causing the harmless heart murmur will make the murmur stop. First, blood thinners. Blood thinners such as aspirin, warfarin or clopidogrel, aprixaban, ravicroxaban or dabigatran. It may be prescribed to prevent blood clots from forming in your heart and reducing blood flow. Second, diuretics. Diuretics reduce excess fluid from your body. Diuretics can help treat conditions that might worsen a heart murmur. Third, angiotensin-converting enzyme inhibitors. High blood pressure can worsen conditions that may be responsible for your heart murmurs. Taking ACE inhibitors can help lower your blood pressure. Fourth, statins. High cholesterol can worsen some heart problems, including heart murmurs. Statins are medications that help lower your cholesterol levels. Fifth, beta blockers. Beta blockers lower your heart rate and blood pressure, which may worsen heart murmurs. Sixth, open heart surgery. In this procedure, the narrowed or damaged valve will be removed and replaced with a mechanical valve or a tissue valve from a pig, cow or deceased donor. Seventh, Ross procedure. This surgery involves the use of your own pulmonary valve to replace a damaged valve. Eighth, Transcatheter aortic valve replacement. This surgery involves replacing the aortic valve with a prosthetic valve. If you want more details, please do watch www.lonestarheartandwellness.com.